All right, guys, so today we're going to talk about injuries. Ted and Emily both recently had some significant injuries that they've been dealing with. And obviously there's a big physical component to injuries, but we're going to talk also about the mental side of things.
I had a lateral meniscus tear of my right knee. So what that meant was I had part of my meniscus had torn and kind of flipped under itself and was creating a lot of inflammation. And that had been going on for about a year and a half, starting in I think the fall of 2014, winter of 2014. So this pain kind of started flaring up around the same time I started playing semi-pro tackle football. And so kind of this lingering pain kind of seemed a little bit like minute compared to other people's injuries. So, I played football with women who played with separated shoulders and herniated discs. And so for me, a little knee pain just seemed like something I could kind of dust off. And it just kind of became sort of like a day-to-day thing that I lived with. And it was something that I felt like was just kind of normal. And it was, the way a lot of people see low back pain, it kind of became normalized. So I didn't feel as though it was something so major that, I really truly had to have fixed.
Yeah, I think that's pretty common. People will normalize pain or blame it on genetics, and pain shouldn't be a normal thing.
Exactly.
It should be something that should be looked at right away and taken care of, right?
Yeah.
So now what did you do? What was the final straw, I guess, in terms of getting it looked at and getting it checked out?
I think it was just, there was so much inflammation, and I finally was just like, I've been seeking out physical therapy. I had active release therapy from a chiropractor who was very experienced, and I had gotten a lot out of her services in the past, and the fact that it wasn't responding in the short term, it was responding to that treatment, but in the long term it wasn't. And so at that point I was like, I really should look into getting an x-ray and an MRI just to see structurally if there is anything that is fixable in there.
So you had the surgery, and you're obviously set back a bit in terms of physical capabilities.
Right.
How did that affect you mentally and emotionally?
It's definitely a bummer, especially, I started working here at Achieve, and all I wanted to do was be able to kind of be the best coach that I could be. And so it's frustrating to kind of feel like I'm limited when I'm also teaching other people how to go through these movements. So that was definitely something I had to kind of talk myself through and just, kind of make people aware of my situation. But also I realized that it kind of gave me a responsibility to kind of show how it is that I stick to my physical therapy and kind of do my homework for my body, and really push through and recover from this well. And so I think to kind of set that example, that was kind of something that I like to take on. And I think it was kind of a virtue in disguise having to do that kind of physical therapy, do a lot of band work, because I discovered that really my hips were a lot weaker than they needed to be, especially to do any kind of powerlifting that we do here. So doing things like clamshells and band walks consistently, doing all those accessory exercises helped to make me stronger and more stable in general. Again, I say it's kind of a virtue in disguise, because now I do those things still on a consistent basis, knowing that that's going to make me, a better mover, a better athlete, and a better coach.
So it actually, kind of that downtime allowed you to really work on your foundation, stability,
Absolutely.
all that sort of good stuff.
Yeah, I would definitely say if you're not already seeking out physical therapy, definitely go consult with one. And we can make referrals from here of people that we've seen and that we trust as good sources. And then I would say, from there, trying to stick with any PT exercises. And then also I think one of the bigger things that I sort of discovered more recently was how much nutrition can play a role in the recovery process. So, I just wrote a blog post on this as well, just about how you can contribute more anti-inflammatory items into your regular diet. So really contributing omega-3s. So that's another sort of accessory that I like to incorporate into my kind of recovery manual, and that's really helped me a lot these past couple months as well.
Now, Ted, you had a slightly different circumstance. Can you explain what your injury was?
Sure. So when I was finishing my senior year of college, I was working out, and one of my arms just sort of blew up. It was like a purplish color. It swelled up to like 3 times the size. And what happened is I had a condition called thoracic outlet syndrome. So the blood vessels and nerves that sit behind your collarbone and between your first rib, for me, got compressed. Combination of factors there, genetic sort of skeletal structure, and then throwing a baseball really hard on my right side for 20 years and lifting a lot. That space just got so compressed that the blood vessels got crimped and blood wasn't getting back to my heart the way it was supposed to, and the swelling that happened thereafter blocked off a bunch of nerves, so I was actually losing feeling in my hand.
So let's fast forward to the surgery.
Yep.
What were you kind of thinking at that point?
I was nervous in the sense of really knowing no idea what to expect. I didn't know how bad will this hurt. I remember I got a phone call from MGH and they were asking about my timeline. I said, oh yeah, the surgery's on a Friday. I think I should be back to work on Tuesday. And the woman kind of paused and goes, no, you're going to be out for 2 weeks. Like, this hurts a lot. It's like, thank you. After the surgery, they said, 2 weeks at home. The most exercise I could do was walk. And I went for a walk, and I remember the first time I went for a walk, I think it was in August, so it was really hot. But I went for maybe a walk around my block, got back to my apartment, fell asleep for 2 hours. It just zapped me.
And now, so, I mean, coming from a super athletic background, you were in really pretty damn good shape at that point. You were finishing 24-hour Spartan races and Olympic lifting and doing all that sort of stuff. And then to be pretty much, you couldn't really use your upper body at all. How did that affect you mentally?
It's an identity shift. It's a change to how you identify yourself and how you recognize yourself. And I knew going in it would probably be tough mentally. So I tried to do as much around my emotional state, my mental state, as I could to try and just stay on an even keel and feel good about where I was at. Because the complete and total identity shift of, I used to do all of these things, well now I'm going to have to try and do these things, can be quite jarring if you're not ready for it with any injury.
And then you got more news.
Yep, I got to do it again. I had such a good time with the right rib getting yanked that I was going to do it again. I got that news 2 months after the right side, so I had just started exercising again. I was starting to get back into a groove, and then they said, oh yeah, we're going to do it again on the left in a month. So 3 months post-op on the right, I had the same surgery on the left.
Can you elaborate on some of the strategies that you use? You mentioned meditating and journaling. Can you go into further detail on those? And any other stuff that you actually...
Yeah, absolutely. Downloaded the Headspace app a few weeks post-op on the first surgery. And just that 10-minute reflection period of kind of allowing your brain to think, allowing it to do kind of what it wants. And I think that was a new paradigm for me in terms of meditation, because I think meditation gets this reputation of being clear your mind, like empty your thoughts, just peace and tranquility. For me, that wasn't the case. It was much more of a, you're gonna think. Let's just kind of remove yourself from those thoughts and look at them and go, do I need to acknowledge that? Or can I just let that one drift by?
Yeah.
So meditation was big, especially around injuries, where you start questioning, like, will I be that same athlete? Will I be a good coach because I don't have the mobility? I was able to look at that thought and go, I don't necessarily have to acknowledge that one. Like, yeah, it's there, but I don't have to act on it. I don't have to believe it. So meditation was a big one. Journaling, just keeping kind of a hard copy of these thoughts. And I like to call them the mental monsters, where in your head something can seem so big and scary because it's there and you haven't really looked at it objectively. Where for me, just writing something down, I can go back, read it, and go, oh, that's manageable. That's something I can kind of dig into and deal with. And then another huge one is I spent a lot more time with my friends. I put a lot more into reaching out to people I might not have heard from. And I think a lot of this, it's all interconnected, being kind of more aligned with, I guess, my soul, for lack of a better term, but feeling more authentic in myself. I just found that my relationships got better because I was communicating more effectively and more authentically, and a lot of good came from this for my personal life, through kind of taking this time to really just recover physically, because that's all I could do. Injuries get a very physical reputation. I mean, obviously we've done some physical damage to whatever it might be, but injuries are an emotional thing. There's a psychological change that happens when you're in pain, and around that, the emotional side needs support like the physical side. You can't say enough about having those people around you that lift you up. That's a huge one. Big one is, if something hurts, get it looked at. That's speaking from experience as someone who has typically tried to remedy themselves more often than they should. So get it looked at, get it taken care of early and properly, and just put it in your rearview mirror as soon as you can. And then there's always something that can be done. I might not have been able to use my upper body a lot, but I was able to focus on mobility, focus on breathing, focus on meditation. There's something you can do that you feel good in accomplishing, something you feel like you're progressing in. It might not be the number on the bar. There's always something that can be done. And with that, you that's where the social support, the coaches, the friends can be really useful, and that they might see an opportunity where you can work on this and it'll benefit these things. I think that's a big one, is finding something you can kind of devote that energy to feel like you're still progressing.
And so one thing I wanted to touch upon is that if you're in pain right now, definitely don't freak out. I would say that 99% of the people that walk through our doors present with some level of pain. And I would say that 80% of those cases often end up just getting resolved just through proper strength and movement training. And also just getting out of their sitting posture. And now if you have been working out and if you've been seeing symptoms for quite a while now, I would definitely not ignore it, just like Emily and Ted said. I would seek out a doctor, a physical therapist, or some sort of medical clinician and definitely get it checked out. In worst case scenario, if surgery is something that you absolutely need, then the most important things that you can focus on, like Emily and Ted discussed, are 1, having a positive mindset, 2, exploring other modalities like journaling or meditation as an outlet. 3 is to be diligent with your physical therapy. And number 4, reach out to your social support system, your friends and your family, because you probably have a lot more people than you realize that can emotionally pick you up as long as you ask. And so that's it. Thanks for watching, and please comment below with any questions that you have or any comments.